Okay, now we're going to talk about accessibility. Let me do introductions first, please. First, we have Dave Campbell with the Institute for Family Medicine, who has found some creative ways that we may hear about for folks to get primary care, access to primary care physicians. Also with us, Maria Snell, a nurse practitioner. I think that's something we're going to hear a lot about tonight as we go forward with the Betty Jean Kerr People's Health Centers. And Alan Freeman from Grace Hill Health Centers. A lot of experience in rural hospitals, I believe you do. So I think that's another topic that's going to come up a lot tonight. Before we get started, though, let's go back to that little thing we call PEN to hear what folks have had to say so far. We also asked you about the accessibility of primary care. I think wait times for new patients can be quite long, considering that most people seek primary care during times of acute illness. Specifically, people with Medicaid have very limited options, and appointments can be months out. I live in a rural area 40 miles from St. Louis. If I needed emergency care, the closest hospital is 15 minutes away. I drive 45 minutes at best for my primary physician. The community needs more primary care doctors, especially that will treat a patient without frequently referring them to a specialist. Doctors' office buildings are filled with specialists, but it's difficult to locate primary care. While there seems to be a fair number in my area, I am severely limited on the number I can choose from. This leaves me in a medical bind, stuck with someone I feel can't give me the care I need. One of the healthcare professionals I see on a regular basis communicates with me via Skype from Colorado Springs, though I initially began seeing her in St. Louis. Not a problem that I'm aware of. A lot of good responses on the PEN. We really appreciate that. Okay, so let's start with Dave, who is lacking access to a primary care physician?
Well, I think in the urban setting, you can look at it a couple different ways. I mean, the main group that we're talking about are those without insurance, or those perhaps with Medicaid, where there's not enough providers accepting Medicaid. But if you look at it more demographically, you're looking at the lower socioeconomic groups, probably the minorities, and also refugees as probably the groups that are having the greatest difficulty with access.
Rural areas, isolated areas, and the urban core, of course, as Dr. Campbell was explaining, that's where access is a problem. Access can mean geographic disparity. Access can mean lack of insurance coverage. There are a lot of ways to define access, and a lot of Missourians have inadequate access to health care.
Okay, so what does that mean? What does access, lack of it mean?
Sure, it's not even, like Alan mentioned here, transportation issues, which it is also a transportation issue, but really numbers of providers. So I know that we speak about physicians a lot, but it's, primary care providers includes nurse practitioners in that as well, which is important to note. And in my clinic in particular, we have 2 to 3 month wait lists for new patients, which is unacceptable.
And is that getting better? I think I know the answer to that, but I set you up with a soft one there.
No.
It's not improving. No. We're seeing fewer and fewer people go into primary care for various reasons, and this is creating an inadequate supply of individuals to provide primary and preventive care in the population. I think you would agree with that.
We're starting with a shortage, and in sort of broad numbers, studies would say that if you're trying to provide universal access, you need at least 50% of your physicians to be primary care. We have about less than a third, and only 25% of graduates coming out of medical school are going into primary care, so that's not going to be a way to catch up.
So what else are people missing out on? Let's go back to the rural area for a minute. What other roles does a primary care provider play besides just, I'm getting it, is mental health a factor?
Physicians and advanced practice nurses in rural areas perform a number of tasks to improve health status. It's not just seeing a person in an exam room. So there's an insufficient number of dentists, for example, in the state. And mental health, as you mentioned, is a real problem in the state of Missouri. There is just an insufficient number of psychiatrists, LCSWs, and others to provide that care. So it's not just in the rural area. We're talking about the rural area and the urban core it's a fairly wide disparity. I think that's true, wouldn't you?
Well, we struggle every day to try to meet the demands in our clinic for mental health services. It's a struggle.
Yes.
And I'd like to make the point about mental health we were talking about earlier, that the insurance companies have sort of carved out mental health and created a division between primary care and mental health. If one of my patients needs a GI procedure, I recommend the gastroenterologist, we make the referral, we get the report back, we discuss it with them. If someone needs mental health services, it's, well, turn over your insurance card if they have one. Turn over your insurance card and look at the number there, because insurance companies have sort of driven things that direction.
And so are primary care providers taxed even more if that is their role in the rural area? And are they qualified to take on this task?
Well, certainly they're qualified. The question is, how much of their practice do they want to devote to different aspects of care? Integration of primary care and behavioral health care, for example. A number of primary care providers would feel comfortable doing a certain level of behavioral health care, perhaps in their practice, but their practices get overrun with so many other, the capacity is limited, so many other needs of the patient population. Again, it gets back to a workforce shortage.
Talk about health literacy. What do we mean by that, and how does that play a role in what we're talking about here tonight?
I think that's a good question. And in the community health centers that a lot of us here represent, we are really trying to educate our patients on primary care, access to care resources, what they need to know to better their health and improve their health outcomes. And a big push right now, I know in our health center, and I'm sure in yours as well, is teams of people to educate these patients, and the focus on education is to improve their knowledge of their condition and what they can do to better themselves and improve their outcomes.
You think about literacy in terms of reading, we're really talking about understanding
Right.
the healthcare system and how to access it. And, educating and, as Maria was talking about, people to actually guide folks is really what's needed.
So they're not waiting until they can barely pull themselves
The
out
term
of bed.
today is patient navigation, and it's care management, case management, helping people guide people through the morass that is the complex healthcare system.
Are your health outcomes actually better if you just have a primary health care provider in your life on a regular basis? Or do we actually see this in a play out in a positive way?
Go ahead.
I think that you do. I think if you have that solid relationship with the provider that can guide you and keep you on the right path, and with a team of people, it's not just one person, that's important to note.
And back to your analogy, it's not only a better outcome, it's also lower cost.
Okay, so how do we fix it? We have about 90 seconds, or about 60 seconds in this segment. Can you fix it in that time?
People need to establish a patient-centered medical home location, and they need to regularly go to their provider so that the provider can help them to maintain a higher quality of life and health status over a longer period. This keeps people out of the emergency department. It helps to avoid acute illness down the road. It's just the best way.
But we just saw a lot of people on the pin there saying that that's not possible for them. How do we make it easier for them?
So we decrease barriers to care. I feel that making more liberal practice for nurse practitioners will be the way to do that. It's the way of the future. It's the way of the world. It's something we need to embrace.
Yeah, and I think that we're talking about access, and again, kind of focusing a little bit on location, and it's beyond that. It's also, and Dr. Pogue mentioned this in his comments, trust. That's one of the largest barriers, and particularly in the lower socioeconomic groups that we're talking about having difficulty with.
Okay, we got.